Good evening, Palmrich Tribe. Good evening, everyone, and welcome to the Tribe Engagement webinar. On behalf of Assetrise, I'm delighted to have you join us today as part of the Palmrich Tribe, a community built not just around investment, but around shared value, growth, and well-being. Today's session is intentionally designed to go beyond the numbers and into something far more important: your health and the quality of what we produce and consume. As a tribe, we believe that true wealth is holistic. It's not only measured by financial returns, but also by the quality of life we sustain. This is why today's webinar focuses on healthy living and the role we all play in promoting better lifestyle choices. Our objectives for this session are simple, to create awareness around practical and sustainable healthy living habits, to provide expert insights on how everyday choices impact long-term well-being, to educate our community basically on the importance of quality and safety in food production, and ultimately to reinforce our commitment at Assetrise to building not just profitable assets, but responsible and healthy conscious systems. We also want this to be, an interactive session. So your questions, your concerns, your experiences, they all matter. So we encourage you to actively participate in the question and answer sessions. And by the end of today's webinar, we hope you walk away not just informed, but empowered to make healthier decisions for yourself and for your community at large. Once again, welcome. Let's have a truly engaging and impactful session. But before that, I think the media has a video for us to watch prior to the speaker coming up. So please, can we have the media with the video on health first?
15th lesson was nothing is more valuable than your health. It's true. It's like nothing we do is going to be more important than putting our health at the forefront. It really isn't, because without your health, you have no wealth. Without your health, you have no relationships. Without your health, you have nothing really, guys. You can't do anything. Like everything is like really just, it's your vehicle. That's the vehicle to everything, is your guys' health. The 15th lesson was nothing is more valuable than your health. It's true. It's like nothing we do is going to be more important than putting our health at the forefront. It really isn't, because without your health, you have no wealth. Without your health, you have no relationships. Without your health, you have nothing really, guys. You can't do anything. Like everything is like really just, it's your vehicle. That's the vehicle to everything, is your guys' health. The 15th lesson was nothing is more valuable than your health. It's true. It's like nothing we do is going to be more important than putting our health at the forefront. It really isn't, because without your health, you have no wealth. Without your health, you have no relationships. Without your health, you have nothing really, guys. You can't do anything. Like everything is like really just, it's your vehicle. That's the vehicle to everything, is your guys' health. The 15th lesson was nothing is more valuable than your health. It's true. It's like nothing we do is going to be more important than putting our health at the forefront. It really isn't, because without your health, you have no wealth. Without your health, you have no relationships. Without your health, you have nothing really, guys. You can't do anything. Like everything is,
nothing is more valuable than your health. Please just keep that in mind as we welcome our speaker for tonight, Dr. Feyitola Olatunji. As we explore practical ways to live well, stay strong, and thrive. Dr. Faye, thank you.
Good evening, everyone. Thank you, Chidima Kali, for the introduction. Can you all hear me? Hello?
Yes, we can hear you, Ma.
Am I audible? Okay,
Yes,
thank
yes.
you. Yeah, good evening, everyone. I am Dr. Feyitola Olatunji, as earlier introduced. And I must say this is a wonderful privilege to be speaking to the Palmrich Tribe, which is a community of visionaries concerning their health and the importance of enjoying a good, healthy lifestyle. From the video you played earlier, health is wealth, right? Health is very important. We have to prioritize our health. And that brings me to introduce you that health is actually wealth. And it's very important for us all to know that without sound health, the entire assets everyone is bringing together, the properties, all the hard work would actually be like a waste of time if your health is not prolonged. And it's very simple. It all lies in our hands. So the quality of our lives is actually largely determined by the choices we make daily. When I say daily, I mean daily, like every second, every minute counts. And it's very important because when you don't pay so much attention to your health on a daily basis, over a long period of time, you begin to see results. And the effects of those would then take another long period of time before you can actually get over them, or should I say reverse them. Hi, can you see me? Okay. All right. So in an era where preventable diseases are on the rise, adopting a healthy lifestyle is actually no longer an optional thing. It's not debatable. It's very, very essential. So I'm here to actually emphasize on the simple, consistent habits, which are supposed to be intentionally daily decisions that can actually prevent, manage, and even reverse many health conditions, further promoting long-term health well-being. First of all, health is not merely the absence of diseases, because I know a lot of people feel when I don't have malaria, I don't have a high blood pressure, I don't have high blood sugar, or as long as I go out daily, I've never treated malaria in a day and all. A lot of people think because there's no particular disease present, they have sound health. But I'll put to you that the health, as we say, is actually the state of the complete physical, mental, and social well-being. Yes, social well-being, mental and social. So it's not just about the physical attributes. It's not just about the physical symptoms, which you can explain. There are some aspects of health that are not so easy to explain. In fact, a lot of people don't know that they're actually a part of their health. So interfering with the body's metabolism naturally over a long period of time is actually the genesis of a lot of lifestyle-related conditions, such as the obesity, type 2 diabetes mellitus, dyslipidemia, and hypertension and the likes. And these disorders significantly impact the health and the quality of life if they are left unchanged. So what's the point actually acquiring wealth when you can't even manage your own health? And in this part of the world, we actually have a very poor health-seeking behavior. Majority don't go or present to the hospital, speak to even a doctor friend or doctor until they break down, which is very, very, very disheartening. So I'm so glad that this particular number of people present on this should actually, at the end of today's presentation, understand and prioritize their health and make it a number one thing. And it's going to be surprising when you get to know even the parts of health that nobody considers. Now, one very important thing that leads to the entire problem is the metabolism. Now, let me tell you what metabolism simply is. Metabolism is actually the process by which food you take in, is converted to energy and also essential substances that are needed for life. So when that metabolism is disrupted, the body begins to experience a lot of buildups of different things. Let me just say enzymes, substances, shortages also of some critical compounds that are very important, further affecting normal function. So this so-called disorder in the metabolism is what actually leads to a lot of problem. And the more it continues for over a very long period of time, it becomes something chronic, which you might not realize at first. In fact, it could take 10, 5, 6 years before it begins to manifest. So that's where we now call it an acquired metabolic syndrome. We have the other parts of it. I'm not going to dwell on that. I'm only going to dwell on the acquired metabolic disorders right now, which are also reversible. And that's why we're speaking more about your lifestyle health and habits that you should consider on a daily basis. So if it's a metabolic, let me just say acquired metabolic disease, actually one of the recognized forms of metabolic disturbances. And it's not actually a single disease. A lot of people think it's just a disease, one disease. When you have one, it's fine. No, it's actually a cluster of conditions, and they don't happen singly, they happen together. So your daily habits is leading to one thing, it's leading to another thing, leading to about 3, 4, 5 things that you're not aware of. And this is what actually increases the risk of heart diseases that a lot of people have. A lot of you find out that some people are beginning to develop stroke. Even young people are beginning to have sudden cardiac death. It's as a result of their metabolism, which they neglected, which they are postponing, and in fact, they don't even pay attention to. For example, hypertension is called the silent killer. You can have a high BP and not be aware of it. You might not even have headaches. Some think, oh, when I'm having headache, my BP is raised. Oh, no. You can actually go silent. The symptoms can be silent, and yet the blood pressure is really, really increased. And it's something that builds up over time. Can be age related as well, but mostly builds up over time. In this part of the world, we have this 9 to 5, 9 to 4 habits of work, and some even work around the clock, and the kind of food we eat, our attitude to exercise and to many things is actually very poor and disorganized. Even the rich fall sick, are also guilty of it, let alone the should I say middle class or the less privileged. So today, the main conditions which actually cause all these metabolic disorders are the high blood pressure, the high blood sugar, the excess abdominal fat, which in some cases we call it obesity for some people, and then the abnormal abdominal cholesterol is actually the conditions that we look at before we then build up something, and then it leads to something bigger, and then continues to lead to something bigger. I don't want to use so much of medical terms for a lot of people here so that we don't get lost in the process. I'll try my best to break it down. So, as I said earlier, I want to mention like 4 conditions. And I know some people are guilty of this, but pay attention to this. And I'm not addressing anyone directly. High blood pressure, that's hypertension. High blood sugar. Whenever you check, when you go to the pharmacy, you might say you want to check your sugar level. They give you a value. Most times above 100, but it could be relative. So don't think that above 100 means I have diabetes. No. Also, when you have an excess abdominal fat, when your abdomen is wide, it might not just be the abdomen, it might be the entire body. Obesity, we usually calculate the BMI, that's body mass index, using the height and the weight. So when your height and your weight are not in sync together, it gives you a value which is higher. You understand my point? But I won't say so much on that so nobody panics. You can always go to the hospital for them to assess you and then give you proper advice. Now, abdominal cholesterol. I know some people, some adults on the group might have gone to the hospital. They said, "Oh, check your lipid profile," and then the doctor just looks through it and tells you, "Oh, stay away from fatty food, reduce your oil." This lipidemia is also a problem. Funny thing is, some people think because they are fat, they have dyslipidemia. Oh no, you can be slim and have abnormal lipid profile. So it's relative. It doesn't have to be that when you see a big person, they're unhealthy. What if they are very tall? Or when you see a slim person and they are, so tall, you feel they are healthy. They might be short and still be healthy. So the BMI, that's the body mass index, and all these values and parameters tested in the laboratories can actually tell if you're healthy or not. And as I said, our way of life, which I'm going to go to, also contributes to these things. So to address effectively, we view these problems through 3 parameters. I mentioned earlier that health is as a result of the complete physical, mental, and social well-being. So we're going to break it down to the physical, social, and mental and social well-being aspect. So we'll talk about the problems in the physical aspect of health, and then the solutions, same as the mental and social. Please, am I making sense? Am I communicating? I need responses. I think it's supposed to be a little interactive, so I need to I need responses to be sure that I am communicating.
Yes, we can hear you.
Hello, are you with me? Sorry, I think I had a little bit of connection problems, but I think I'm back on track. Can you hear me now? And are you with me?
We can hear
All
you,
right.
doctor.
All right. Thank you. Thank you very much. All right. So I spoke about the physical aspects of health. I'm going to give a clear an example, and I want you also to flow with me as I create that example. So that example is actually going to lead us to the solution. All right, I'm going to give you an example of a patient I met at the clinic. She is, let me just say she's overweight. She's really big. She's chubby. She's a banker. Are you with me? She's a banker. She works, I know bankers work 9 to 5. They close at the bank for 4, but she stays in the bank till like 7. She doesn't eat breakfast. She doesn't have time for exercises. She goes to church, of course, on the Sundays. Whenever she has functions, she attends. She does a lot of binge eating. When I say binge eating, eats at night. So it's whenever she's free at home, maybe she has to work overnight or want to sort of create a form of relaxation for herself. She decides to see a movie, and then she's able to eat all the food she was unable to eat in the morning. She eats it at night. So that's, I'm just trying to tell you her lifestyle. And then the following morning, she skips breakfast, goes to work. She's so active at work because there are always so many people coming to her office for one complaint. You know how the bank is. And afterwards, during lunchtime, she just grabs Coca-Cola and meat pie. That's her usual snack because she believes the Coke gives her caffeine. It has caffeine, so it keeps her alert and able to work actively even after closing hours. And when she's done, she drives home. Now, she sits in one place because most of her job is while she is sitting down. She's not the one on the counter. So she sits down. And, that continues. She's married. She has about 2, 3 kids. And she's been going on and on. So all of a sudden, one day at work, she suddenly collapsed. So that was why she became my patient. And on getting to see her, she looks so beautiful, healthy, beautiful skin. To us, she looks healthy because her skin is so plump, but she's chubby. And then I asked for the symptoms she had. Funny thing is, she had no symptoms before the time. She was perfectly okay. All she knew was she opened her eyes and met herself in the ambulance. And they said they were taking her to the hospital. And afterwards, she still, I think, went back into sleep again. I don't know what exactly happened at the workplace. But on getting to see her and we tested her, we realized that her blood pressure was, in fact, skyrocketed, was very high. It was about 150, 110 at the time. She was speaking normally. Her heart rate was low. It was all right. It was perfectly fine. Blood sugar was at the diabetic range. And the funny thing is, she knew she's been just drinking a lot of water at work, but she just gets thirsty because she pees a lot. She doesn't get to eat, like I said, because she's always busy and active. So when she gets home, she eats all the food she's unable to eat, like she eats this, and then, she likes ice cream. So she takes a lot of ice cream while she's seeing a movie. And then she sleeps late and wakes very early. And bankers now, she doesn't live on the island and she works on the island. So she has to wake very early. So that means she sleeps in a short time. So I'm trying to paint this scenario to you because that's the lifestyle of a lot of people in this part of the world. But she's been fine. She's married. She looks beautiful. She sings. She says she loves to sing, but doesn't have time to go for rehearsals anyways. But at least whenever she's in church on Sundays, she's active. So this is someone that has been active Monday, Tuesday, Wednesday, Thursday, Friday. Weekends, she's also busy because most bankers in that particular level go to work on Saturdays or whenever they are being called. Sundays, she's going to church because she's active at church. So the little time she has is just Sunday evenings to prepare for Monday, and then the marathon goes. Also, she's on the big side, like I said, she's on the big side. So, and by the time we began to do investigations, checked her cholesterol level, it was very high. And I told her something. I said, thank God you fainted and you were resuscitated and you were brought to the hospital up to the point where you met with the doctor. And she was wondering why. She was like, oh, and right there, she was already telling me she has to be at work on Monday. She has to be at work on Friday because that was a Wednesday. Now imagine someone that collapsed at work. All in her head is how she's going back to work because she wanted to attend to people. So I like that. She's hardworking. But she forgot something, that episode she had could have led to her death if she had it a second time, or would have led to a stroke if she had it a second time. And if she had the stroke, she won't be able to go back to work. Somebody else will replace her. And the moment I said that to her, she was calm. And she was like, okay, what do I do? Give me medications to forget about. Now, that's the mistake a lot of people make. We feel that once we are on medication, we get going. Once you give me medication, so how many medications do I want to give her? I want to give her something for high blood pressure. I'm going to give her something to lose weight. Oh no. If I give her all those medications, because her body is still going through the same metabolism, it will destroy her liver and her kidneys. Now, we have a lot of people that come down with kidney problems, liver problems, and we're like, oh, they are too young. And in this part of the world, everything is village people, without knowing that our own lifestyle is actually causing a lot of harm. But I can categorically tell you right now that without any medication except supplements, the lady is fine. Now, it took a while. It took a lot of dedication. It took a lot of her changing her lifestyle and dedicating more to her health and prioritizing more of her health, considering the fact that she has family, she has children. If she's away, another woman will take care of her children. Don't let us deceive ourselves. But she had to sit down. It was not so easy for her, but she had to. Why? Because death was staring at her at the face. Now, why I gave this example and of the patient, I've had serious patients. I've seen patients that eventually passed on due to the lifestyle. Some are working so hard round the clock to provide for family, but when they die, somebody else will take over. They ask somebody else for money. So it's very important. Put yourself first right now. And the only way you can do that is pay attention to your nutrition. Like I'm going to say now, I want to speak of the physical aspects. Your nutrition is very important. What you consume, what you eat is what you're made of. So some people will say, I have genes. Yes, there are genetic disorders, there are genetic inherited disorders, there are inherited traits of big people. But who told you that it is healthy? It's not. It can make you die, like it could make the person, not you particularly, it could kill a person instantly. And then we start looking for the cause of death. Yes, it's staring us in the face. I once had a patient while I was a medical student. Okay, it was not a patient anymore. It was a corpse, but they did an autopsy because they didn't know the cause of death. It was very big. He was playing football. Of course, he was enjoying something, trying to do something fun. And while he was at the ball, he slumped. So our students, they wanted to do an autopsy and we had to be there. At that point, he wasn't embalmed because autopsy is not usually done on embalmed patients. Though they do on embalmed patients, but it wasn't. I know he was so fat. The fat that was taken out of his body was up to like almost 10 or 15 liters. I'm not exaggerating. He had a lot of fat in his body. And when the person dies, it turns to liquid. So they were able to get the fat out of his abdomen. And before we could realize that the heart, if you make a fist, if you're looking at me, if you make a fist, that's actually the size of your heart. So if you're very big, make a fist right now. Look at yourself and make a fist. That is the work. Now look at the work you are giving that small heart to pump blood to the entire body. And when I say entire body, up to your skin. So if you're giving the size of your fist that much work, if you're big, then you should pity the heart. So the man's heart was just like the size of his fist. So it had overworked because it was trying to pump blood to his body. And guess what? He's not just obese. He is tall. He's not just a fat person. He's a tall man. So trust me, he has to pump blood all over. And when you're an adult, the bones that produce blood are just the long bones of the body. The rest of the bones don't produce blood anymore. So imagine the stress he's giving his bones and also that heart. So by the time they brought out the heart was flabby. It wasn't firm like the heart we see, in live cadavers cadavers that are fine. But his was flabby. You could see it. So he had overworked that heart. Compared to the ones we saw in the museum, his was flabby. So we could tell he died of a cardiac problem, insufficient cardiac output. The heart could no longer pump blood. So he slumped. And the funny thing is when a person slumps, it's just like electricity being disconnected, just like it cuts off. The person just falls, boom, like a stick, like you drop a pen. And at that point, before they can, in this part of how many people understand how to resuscitate someone? Everybody will run first. That's the first thing, which is really bad. Nobody thinks of CPR. Who even knows what CPR means? So before they took him to the hospital, he was already gone. So by the time they told his family members, it was disheartening because I'm sure they thought he was poisoned. But he wasn't. There was no trace of poison in his entire system. It was just that heart muscle. So all this I'm trying to explain to you is not just I'm not paying attention. I'm not attacking the big people. But I'm just trying to tell you that a lot of things are wrong with people's body because of what they consume. Also, some people be like, oh, like I mentioned, she likes to eat junk. Meat pie is not bad, though. Coke is not bad, though. But when you prioritize it and make it your major meal, it is bad. I hope you get me. Ice cream is not bad. But if you make it a major meal, or you don't do if you look at the back of all these things, they have 7 sizes and seven portions that you should take. So and also a lot of people, how many people take fiber? How many people take oats? How many people take even Gary? As simple as Gary is, as cheap as Gary is, do you know it is really nice and it's healthy? But a lot of people don't. Instead, we take the eba size that is bigger than our heads, and we take it after 6 p.m., maybe like 9 p.m. Now, let me put something to you. Anything you eat in the morning stays in the body. and your body works it, converts it to energy in the afternoon as well. But once it is getting close to 6 p.m., the metabolism of the body reduces. So everything you eat is stored as fat. So that's why a lot of people that eat very late store the fat in there. And the most beautiful place for the fat to store is the abdomen because there's space. So it stores as fat in the abdomen. And then the following morning, there's an hormone in the body called cortisol. In the morning, it surges. So when you're active, it surges. Reason is when you eat breakfast, you eat little, especially carbohydrates, it digests fast. You understand me? So the cortisol will mobilize sugar from the areas of the body that sugar has been stored, and then your body keeps going. So imagine you having to have eaten junk. Of course, it's only going to bring out the little bit that you need, depending on what you do in the day. So if you've been sitting in one position, you're not active. So the one in your body, if you had breakfast, is just working and then that leaves. Then the cortisol, because you have to work, your head has to work, your brain is active, it produces enough for you to work while you are seated. So you don't move around. The blood doesn't really circulate. You eat only junk food that gives you empty calories, no fiber, no moving around. So whatever you eat at that spot, it just stores because you are not using it. You are not moving around. That's why we advise, even while at work, if you have someone that sits in one place, take a walk around, come back to your seat. Take a walk around, come back to your seat. It even helps prevent deep vein thrombosis, which is what causes, most people that sit on the aircraft and stay for long, and then they say they died suddenly or they could not breathe. That's what causes it. So move your legs wherever you are. Even when you're seated, if you feel you can't move around, flex your legs wherever you are or stand up and move. That's another thing. And then you get back home and don't eat at the hour, or some don't eat after 6, 7, 8, 9, 10. Whatever you eat stores as fat. Now, the following morning, the cortisol will produce and mobilize a little bit, but not up to the one you have stored. So if it only produces a little, the cycle continues. So for example, if you skip breakfast, it will provide the one needed for you for that day, but you still get fatigue because it's producing glucose from non-glucose sources. So once that one, and let me put it to you, the one that stores in the belly is fat, but it does not use the one in the belly first. It uses the one in the muscles first, your arms. Do you understand me? So the one in the belly is stored for last minute use. So you keep storing it. You keep storing it. So the cortisol will only mobilize from the muscles and all that, but it goes last to the fat. That's like the last. That's why when people fast for a long period, they lose weight. And that's because they fast for a long period. That's when the abdominal fat can reduce. And once fasting stops, everybody continues their regular routine and then they gain weight again. So let's make sure that we pay attention to our health. More protein, more fiber, less fat, and make sure you eat breakfast. Lunch is also good. The swallow, all the orishirishi soups can be eaten in the afternoon. At night, prioritize more on vegetables and protein. It's very important, and try not to eat after 6, 7 p.m., except you're pregnant or you're breastfeeding or maybe elderly. But for the elderly, we take caution because they might have some illnesses, maybe diabetes or hypertension they are managing. Also, reduce sweetened fruits. For example, if you needed to be alert, you didn't have to take Coca-Cola, just walk around, move around. And if you need to take a few minutes nap, 5 minutes of sleep is very important. You could, and you spring back again, and then you're active. But don't substitute water for drinks, especially carbonated drinks. You can take it maybe on social events once in a while, that's like a cheat day, but not some on a regular. Also, physical inactivity leads to weight gain. Some people sit in one place. Some can't even lift a bucket of water. When they lift it, their heart starts racing. That shows that you're not active enough. So a lot, and that also leads to, I'm sure because the person has poor circulation, they start getting tired just by lifting a bucket. Some will tell you, I've never done this, I've never done that. It's not because we see you as try it. It helps. Also, sleep deprivation. A lot of people don't sleep. Like I told the patient I was talking about, she doesn't sleep well. She doesn't sleep up to 8 hours. In fact, up to 6 hours by the time we checked the window because she works late and wakes very early. She's up again by 4. She has kids and she has to get to work on time. And then she has to work late into the night and sleeps as late as maybe 1 or 2. So what time does she have to sleep? And this brain, which is what we use, which uses a lot of glucose more, has to rest. So also, if you don't sleep or as well, apart from the brain wanting to rest, you have hormonal imbalances. Some people have hormonal problems. I'm not dwelling so much on that, but sleep can actually lead to it. For example, the cortisol I was mentioning, which is the hormone, is an hormone. So because you don't sleep well, there's a problem. It disrupts the release of these hormones, all the hormone necessary for being active, the hormone necessary for sleep, the hormone necessary, it disturbs it. So once that happens, there's a disturbance in the metabolism of the body. I hope the metabolism thing is beginning to sink. Also, harmful substances. Some people take alcohol and think, oh, they become active with it. For example, long distance drivers take alcohol because they feel they are going to be alert. Some take a lot of codeine because they feel they want to rest, they want to chill, then later they become active. Some take too much of coffee. And some abuse a lot of substance of abuse just because they feel, some because they're addicted, and some because they feel it helps. I know someone that used to take Coca-Cola and coffee. One is bitter. He said the Coke will make his sweet so that he can read overnight. Eventually, he slept off. He slept to the point that it was difficult to wake. And when he woke up, he was useless. So a lot of things that people have tried that has worked for them does not necessarily have to work for you. So please, let's try our best to pay attention to this. I hope I'm creating a practical scene where you actually think and put yourself in the shoes so you know how to guide yourself. So, like I said, consistent exercises, even if it's just to take a walk in the mornings, if you don't have time. I know a lot of people are busy on this platform, so some might not have the time to go to the gym or even have gym equipment, but just taking a walk around your house is very good. It's going to keep you active. Some have a cycler in their houses. You could invest in one. Just cycle for a few minutes in the morning. You're fine. You're good to go. Good to go. You can just take water and try your best to take water in the morning. It helps. It helps a lot. It helps to restore even the guts in the mornings. Also, to strengthen your muscles, exercise helps. And then, you won't be able to pant so much when you lift a bottle of water next time. That's one thing that exercise helps. And it also reduces the burden of all these metabolic issues that we're talking about. And like I said, sleep restores hormone imbalance. When you sleep, when you have quality sleep, you might not sleep for too long, but at least sleep is very important. Whenever you're doing anything and you feel your body is tired, just sleep for some minutes. I know a lot of people have deadlines to meet. A lot of people don't want to be disappointed, but sometimes disappointment of just one day or just one few minutes does not make you a bad person. Sleep, because the moment you are not able to function or something is wrong, somebody else will do that thing. Also, avoid harmful substances, smoking, alcohol, drug use. Please stop it. I know it might be difficult for some, but I know some people can undergo therapy for that. Also, the mental aspect, which is a very, very big deal of health. That part, I really need to talk about it because a lot of people don't think it is part of health. And also a lot of people feel that it attracts them a form of stigma to themselves. Mental health does not mean you are mad. And mental health does not mean that you are crazy. When we speak of psychiatry, we are not saying we are weary. No, it's just an imbalance of the hormones and some electrolytes in the brain. So some people on medications, they do well. And some people only need therapy. But as I put to you, just the food you eat, you exercise also has a very great impact to your mental health. Also, your own personal relationship with people is very, very important. Mental health has to do with your thoughts, your emotions, your decisions. That's when your decision making, your coping mechanisms. There are so many people. Okay, let me cite an example also for this case. I know somebody that does not like to fail because all the while she was growing up, her father was always making jest of her whenever she fails. There was never a time where anyone would say, oh, you can do better. That happens a lot in a lot of Nigerian homes where they start singing Olodo Rabata, Ojo Ejalu Moje, that kind of thing. Nobody says you can do better. And nobody tells you that failure is part of success, part of success. So she doesn't like to fail. So whenever she's not getting it right, she withdraws. She might not come to class. She might not talk to anybody. She just feels she has to read more. She didn't think of the place of prayer. Oh no. All she just thought was, I just have to put in more effort. My father, my father, my father, my father. That was the only thing in her head. Also, because of such childhood issues, she had issues making decisions. She's always confused at making decisions. So she ask A, ask B, ask C, ask D. She never had a mind of her own. All because she was scared of making the wrong decisions. And then she always had this evil thought, oh, what if I fail? What if the negative thoughts were the ones coming on? Then let's not even talk about her coping mechanism. she does not even know how to cope. When she's about to hear a result, or maybe somebody mistakenly, in fact, there was a time somebody mistakenly broke a result to her. She started bleeding immediately. She started, she started bleeding through her nose, and then her menses appeared straight. I'm speaking of a lady. That's how to tell you that the mental state of your body can control everything in your body. Some will say, oh, no, she just couldn't. That's to show you that whatever goes on in your mind can actually affect your physical health. Some people are not happy. They are getting lean, but they consume a lot of food. People see them eat. They even smile and play. Yet they go back into their shell. They are not happy. It still has to do about your mental health. But the problem here is a lot of people don't know how to share with other people so that they are not mocked. There are so many of you, let me put it of you, that don't know how to keep secrets. So many people don't know how to keep secrets. So many people don't know how to even make people feel better. Instead, they make them feel worse. Some people just talk anyhow to people without knowing how the other person feels. All these things affect thoughts, emotions, decisions, and also coping mechanisms, and also eventually affects the physical health. The fact that we said physical, mental, social does not mean they are different. They are intertwined. All this play a major role in the development and the maintenance of an acquired metabolism as well, because whoever is thinking such will not eat. Whoever is doing such will withdraw ourselves. We don't want to mix. We don't want to even do exercise. We'll never be active. She'll be so down that it can even tilt into depression. All these things cause depression, anxiety. There are some people, because of the fear of something, they don't know how to make this decision. Some have phobias for many other things. Many crazy, funny things that you'll be so angry, oh, I don't have it. But because you don't have it doesn't mean another person is not suffering it. Chronic stress. Like I said, chronic is something that happens over time. All these things I'm talking about, and coupled with the activities that you do, the work, you going to work very early and all, is stress. It increases the level of the cortisol in the body and also increases the blood pressure. And once the blood pressure increases, you are worried, you won't eat. Some people are so sad they are withdrawn because they are thinking of what happened to the blood pressure, as if their thoughts will remove the blood pressure. But nobody is there to motivate them or to say anything to them. They are thinking about it themselves. They don't know how to cope out of a situation. And the cortisol level is still rising because it's affecting the physical well-being of the body. Emotional eating. There are some people that are not happy. Something is bothering them. They are so shy. They have low self-esteem. They might not admit it. But you find them binge eating. They just eat. Just to make. They eat to allow the thoughts go away. Some do crazy stuff just to allow the thoughts go away. Some will maybe tint their hair because they feel it's going to make them big. Some make funny decisions just to alleviate or remove every problem they have. Any mental issues, let me put it that way, that they have. It's not that they are mad. So all this I'm talking about still has to do with your health, even in making decisions, like I said earlier. Also, anxiety, it can cause burnout, fear of not wanting to lose, the fear of, did I appear well? Some don't even like them. Some don't see themselves as pretty. Some see themselves as, oh, nothing fits me. The mind. And this affects different hormone works. The body is meant to relax. The circadian rhythm work, that's the day and night cycle in our body. It's supposed to work. But once it is disrupted, it affects your health. All this still has to do with lifestyle. And like I said, poor mental resilience as well reduces the adherence to healthy habits. So the moment you have all these issues, even if you had made up your mind that you want to be eating in the morning and all, it will be broken. You would not follow it. You won't be consistent with it. So if your mental aspect of your health is stable, the physical aspect won't be an issue. So how do we manage this? Stress. Stress management is another topic for another day. But I'll just give you points. Being mindful. It helps you to stay present. It also reduces anxiety. Even if it's a few minutes a day, just, say something positive to yourself. Think positive about others. Don't say negative things. Don't be the person that is there to scatter people's relationships and then think that things will move for you. Oh, no. You spoil relationships and it will come back to you. But be positive about everything you do about yourself. Be positive about yourself. Say something sweet about yourself. I'm beautiful. I'm loving. I'm going to excel in this. Say positive things to yourself. It helps you every day. It motivates you. Even though you step out and someone is like, Wobo Sheri, don't listen to them. That helps you to control your thoughts, your emotions, and it helps you to cope in every situation in which you are. Prayer. whatever religion it is that you practice. I'm a Christian, so I'm going to speak from my Christian aspect. I pray. Prayer helps. The moment things are looking rough, you don't understand it, just go on your knees and pray. There's always an answer. God doesn't have to come down and speak clearly like he used to speak in the days of old. But that solution will come. That peace will come. You feel relaxed. There are faith-based communities that you can join. Now, in this aspect of the world, in this part of the world, let me put it that way, we are so religious. Would I say religious but not godly? Let me put it that way. I don't know. We love to follow people. This is Pastor Eze today. Sorry, I have to mention names. We are going to continue chanting. Once it is Pastor this today, we follow. Yes. Funny thing is, those communities help. But stick to one. Don't be confused. Don't be spiritually confused. Stick to one. If it is a daily mandate, stick to it. If the prophecies make you feel better and you are going to do as they say, stick to it. Don't listen to it because you want everybody to know that you're listening to it and yet be doing something else. Oh no, you are still going to go back to square one. So your faith-based communities can actually help you to get out of stress. Also, sense of control and emotional relief. Don't be the bad person outside and the good person inside. That doesn't help. Also, when you have a structured routine of your daily activities, it helps. You know you have to pray, you know you have to do this, you know you have to do that. Don't let everything be modular. Sometimes some people, when an environment is scattered, it affects their psyche. It affects them. In fact, when there are too many lights, there are some people that when there are too many lights, they can go into epilepsy seizures. That's the epileptics, when there are too many flash of lights. That's to show you that the brain works with the mind as well. So sometimes an environment, if you feel that, your room is dirty and it makes you bothered, create a routine where you know you have to tidy your room. Create something that everybody around you has to follow. Even for those that have workplaces, create something that is going to work for you and also work for them. Don't be selfish, All those things keep you out of stress. You are not managing yourself and then managing other people. You are making sure that whatever you're doing is also extending to the people around you. That helps you and helps to lower stress and also reduce the harmful physiological effect of stress, because there's no part of stress that we go through that does not affect our physical health. In fact, we confuse stress for exercise in this part of the world. Exercise is entirely different because it releases a different kind of hormone. Stress releases a different kind of hormone. So you must be able to know the two, know when you're overworking yourself or straining yourself, and then reduce it and know the times to rest. Also, like I said it before, sleep is very important. Sleep and exercise habits work together. It's also a part of the mental aspect of health. It helps you when you sit down, you take breathing exercises. It refreshes your brain. It relaxes your mind. And a new day starts. That's a new day of positivity. So improved mental health, as I said, will strengthen your resilience. And then the social aspect, which is the last, I know I've gone past the time. Social aspect of health is actually the last part I'm going to talk about. Now, the social aspect is relationships and support systems and also community engagement. Now, you think that, because it's not related to injection and medications and IV fluids, is not health. Oh, no. Even in the health sector, we emphasize on social health. We have community groups. We have a lot of groups, friends, and where people come together. Even, for example, if you've been to the psychiatric home before, or maybe on an excursion, they're not saying you went to visit a patient. If you've been there, you know that they have groups. When you see all of them, they sit in groups. They talk. They have the occupational therapy aspects where they sit in groups. They teach, they learn. All these things help you, especially at the workplace. It helps. Coming together and doing something aside work, doing something productive, engaging, bringing everybody together helps. If you isolate yourself, even in the workplace or amongst family and friends, it will lead to depression and poor motivation. If you feel you are better than everybody, that's also social isolation, if you don't know. Some people think, I'm prettier, she's not my class. You're isolating yourself, my sister or my brother. It can lead to depression eventually when everybody identifies that you like to isolate yourself and then they leave you to one side. And then you start feeling they don't like you, you're the bad person. Oh no, you isolated yourself. You are making yourself feel depressed while they are moving on and enjoying themselves. So try your best to, balance it. We call something healthy relationships and social connections. Strong family ties, strong friendship, community support improves emotional health. And it also encourages positive lifestyle and behavior. Please let's try as much as possible to practice that. Then also the lack of support. lack of support. It reduces accountability for lifestyle changes. So let's try our best to support ourselves, support those around us. You could join communities which will help you. You know, sometimes when you feel, oh, the rate at which I am going is just me on this journey, there are always support groups. There are always there's always one good person somewhere, or there's a mentor somewhere you could follow, even if it's just to go for one of the programs, pay for something, and just attend it. And you know, he restores your spirit, he lifts your spirit, he makes you even more positive, and then you come back as a refreshed person. He's not usually too much. He helps, and he helps your health, the social aspect of your health. Also, shared wellness practices. You know, exercising with others, not just you yourself. Sometimes when you take a walk, depending on where you are, you meet other people. Some go to football fields to play with other people, and some also enjoy healthy meals. You know, in this part of the world, we don't do dinner where the family will come together as you only go for dinner with your friends. Oh no, family members could come together. Just you bring this, you bring that, and then we sit down, play games, and then we live happily ever after. You know, make it sweet and beautiful. It helps. It helps you to communicate. It helps you to build your self-esteem. It helps you to interact properly. And it also helps increases consistency and motivation, even when you go out there. Those are also parts of health, because whenever we address health, we don't address health as an individual. We address it as a community sometimes, because when you're sick, you need people around you. You need somebody to motivate you. You need somebody to help you. You need someone. Forget the fact that, oh, we have doctors and nurses that are being paid to do it. At home, the care at home is actually more important than the care at the hospital. So, and as I said, all this results in positive relationships. It creates an environment where healthy living becomes sustainable and meaningful. In partnership with Assetrise, for further consultations, the Phoenix Medical Group and also the First Care Health are available for you to communicate with, in case you want to come physically to see a doctor or you also want care at home. I'm going to end the note by saying that acquired medical disorders affect the physical body, the mental well-being, and also the social functioning of our individuals. And treating them effectively requires you to, requires more than medications. Let me put it that way. Is required more than medications. And as I said, if you remember, I've not spoken anything about medications since I've been talking. I didn't say anything about paracetamol. I didn't say anything about vitamin C's. I didn't say anything about, other drugs that people use. Let me put it that way. I spoke about your lifestyle. I have physical examples of people that the lifestyle modification reversed their diabetes. It reversed their hypertension, also reversed their high lipid profile. They didn't have to use any medication. All they did was stick to the plan. And they've been consistent with it. And over time, they kept going back for the investigations, and the results, the values were dropping. And I can tell you categorically that the values are back to normal. Thank you so much, Assetrise, for the time. Thank you, Palmrich Tribers, for your time, for taking time to listen to me for the past almost 50 minutes. Your Dr. Feyitola Olatunji once again. And I'm pleased to have this session with you. And I'm open to your questions and answers. Thank you. And questions. Thank you.
Okay, thank you very much, Dr. Feyitola. I hope we've had an impactful and very educational session. Please, if you have any questions or any further clarification, or you need any further clarification, kindly write it out in the question and answer box, and your questions will be attended to. So while we're writing down our questions, so wait for the questions.
All right. So it all depends. I don't think there's anything wrong with you if you take water up to the night. Now, you said you take about 4 to 6 bottles during the day. If I would actually need a response from the person, because if you walk in a place where the air condition is always on, the frequency to urinate might be there. But if you've urinated more, your body might need to conserve water. So when your body conserves water and you leave to go home, when you're home again and you then take more water in a warmer environment, you might actually get to pee at night about 2 to 3 times. But I'm sure that the 2 to 3 times does not happen every night. If it's 1 time, it's not bad. If it's 2 times, it's not bad. If it's 3 times and it happens like that every time, then you might need to work on the times you drink water, or better still, reduce the water you drink at night. But if you take about 4 to 6 bottles during the day and you are active during the day, or you sit in an air-conditioned room where most times you just go up to pee and you'd have peed, and then you're out again, your body has conserved water, and then you drink water at night, it might not be a problem. So I think I'll need the person to respond, maybe via the chat.
Okay, so um, on to the next question, please. At what stage can we say that someone is hypertensive?
The value that has been established is when the systolic is greater than 130 and when the diastolic is greater than 85 millimeters of mercury. That is when we can say a patient is hypertensive. And it's actually when it's been consistent. So, for example, you checked your blood pressure after a very active day, it might be slightly raised. So if you have that value, I might not be so worried. But if you wake up in the morning and then you check your blood pressure and it's over 130 or 85, and then you check it again, maybe after a little bit of activity or rest, and it's still raised within the same day up till the night, and then it repeats again the following day or even the third day, then I can say you are hypertensive. And most times, the person might have been having occasional symptoms, even with a normal blood pressure. So it's not something that you just check your BP today and then it's 130/85 and I say, oh, you're hypertensive. I might ask you questions. You might have consumed a lot of salt. You might have not even taken enough water that day. And you might have been doing something very rigorous. For example, maybe you ran or you walked a very long distance or you are stressed. So it's something relative. So if I'm going to say you're hypertensive, is the result must have been consistent. You must have been checking daily every morning when you wake up from bed, not active after you have rested for like 5 minutes sitting up. And then you check it with a proper device that has a good battery. You understand my point, in a right sitting position using your left arm or your left wrist, depending on what you're using, and it's been like that for like 2 3 check-ins, and also within that same day, even after being active, it's still raised. That's when I can say, okay, madam, you have a high blood pressure.
Okay, thank you for that, Doctor. Another question is, thanks for the lecture. And I'm in my 40s, just discovered that I feel pains in my knees joints. What should I do?
Okay, I think I read that question. The person is in her 40s or is her 40s, right? And she just
Yeah.
discovered that she feels pain in her knee joints. Well, it all depends. Knee joint pains can be as a result of weight. It can be as a result of hydration, and it can also be occupational. So, are you on the big side? Do you have a very big, some people have this beautiful waistline. I call it beautiful waistline. They have the beautiful shape, the hip and the bum, and then they have small legs, narrow, very small, narrow knees that are not so wide enough to carry that weight that much. And some gain weight, some are not so hydrated, and some do a lot of work that has to do with standing for so long. And some even work in very cold places where they sit for long and they don't get to flex their knees. So knee joints can be as a result of many things. It's not just about the age. So the question, sorry. Yeah, so if you feel knee pains, we might need to actually ask you a few questions and do some assessments before we can make that conclusion.
Okay, Doctor. Our next question. So, okay, thanks very much for the lecture. How can I reverse HP that has been managing for over 6 years? If I don't eat and take my medication, my body will be shaking. I will only be stabilized until I eat.
Sorry, please, can you go over that question again? Okay, I've seen the question. Thank you very much for the lecture. How can I reverse HP that I've been managing for over 6 years? If I don't eat and take my medicine, my body will be shaking and I'll only be stabilized until I eat. Okay. HP, if I may ask, Is it hypertension that the person is trying to say? And also, if you don't eat and take medication, if you don't eat and your body is shaking, it means you get hypoglycemic quickly. So that one has to do with eating. But HP does not relate with your meals. Hypertension is a different ballgame. Hypoglycemia is different. So if you're a kind of person that when you don't eat on time in the morning, you start feeling tired, your body starts shaking, it's always good you have breakfast on time. But you can also check your sugar level, maybe do a fasting blood sugar level, and then before you eat, you can always do that before 8 a.m. or exactly 8 a.m. if you have the device, or better still, go very early to the hospital and tell them you want to check your blood sugar parameters. They would answer you. So that one might be telling us something else. And it might just be, it depends on your body weight. If you are on the small size that don't get to eat so much, or you have a high metabolism, your body might be shaking early in the morning before you eat. Concerning the HP, if it is hypertension you're trying to state, and you've been managing it for over 6 years, your medications are important if your blood pressure is high. For example, when you check it in the morning and it is not raised, there's usually no need for you to use the medication, depending on what you're using, because the medication can further lower your blood pressure and then lead to another thing. And it's more difficult to raise your blood pressure than bring it down. So it all depends on the interaction I have with you, not just by typing.
Yeah, I hope your question has been cleared, answered and cleared properly. Okay, so for the next question, for those who hardly experience sickness, what will you prescribe of going to do a regular checkup routine?
What will you prescribe of? Oh, no, no, no. There's usually, yeah, yeah. Like, remember I said earlier that there are some people that really don't fall sick. Some people don't fall ill at all. But it's ideal that you have a stipulated time for regular checkup. It might be 6 monthly. You might do it, biannually. That's you do it in the beginning of the year, and then, or maybe whatever time you choose, you go again after 6 months. But sometimes, depending on your results, the doctor might actually give you a better time to come back. For example, for women, when you check you, assess you, they might tell you, oh, come back after so to repeat this test. And even for men as well, depending on the age, depending on the investigation that is within that spectrum of the routine checkup.
So the next question.
And then,
I
sorry, another thing, if the person is overweight, he or she will snore. So you can also advise that the person goes to see a doctor and also practice and modify their lifestyle. To lose weight, it can also help. But don't say it in a way that will make the person feel hurt. That's very important.
okay, so the
I
next
hope I
question.
answered the question.
Our next question. I don't work in the air conditioned office. When I wee in the night, I still feel thirsty and have to drink during the night time. I'm a very active person and I move about a lot.
Okay. The advice I'll give such a person is, okay, first of all, your metabolism might be on the high side. If you have a high metabolism, you might be having to drink water a lot because you're quite active. But also, speaking of very active, we doctors see things in different lights. So you could decide to do the thyroid function tests and also check your blood sugar. And when I say blood sugar, I'm not speaking of just the random one they just prick you. You have to schedule a day to see a doctor and then go to the hospital at the very early hours of the day, because the sample they're going to take, they have to take before 8 a.m. And that's your random and the HbA1c. And then they tell you to wait after 2 hours, give you something to drink, wait after 2 hours, and then they test your random blood sugar. That's the 2 hours postprandial. So when we check those values, and coupled with your thyroid function test, then we can tell if it is okay or there's something you need to do about it.
So that was cleared up. So our next question, please, what's the right time to eat dinner?
6 p.m., latest 7 p.m.
The next question: what if I eat dinner or by 5 p.m. and by 9 p.m. I'm seriously hungry? What should I
Yes, by
do?
9 p.m., if you're seriously hungry, take low caloric vegetables. For example, cucumbers. You could eat lettuce without cream. You could have carrots, and you can even take gari without sugar, and maybe very little granite. That's fine, but don't take too much. Don't eat eba, and don't eat any other protein.
And next question: relating to high blood pressure, will the drugs be taken for a lifetime when a doctor prescribes? What can regulate and stabilize high blood pressure?
All right. A lot of people have seriously established high blood pressure. That whenever they stop their medication, it becomes a problem. Such persons, they say, will take the drugs for life. But when we say lifestyle modification, depending on the value of the blood pressure that we get, it has to be a gradual thing. So what can regulate it is simple exercise, not energetic. I'm not saying get a cycle and start cycling. No jogging, just simple brisk walks early in the morning and even at night before going to bed. Brisk walking is simply walking not too fast, just walking around without any interruptions. Preferably, some people call it prayer walk. You could do a prayer walk around. Don't walk too excessively. You might sweat a bit, but not so much. And you can time it. But it does not mean you should walk the entire steps of the day during that period. Also, when you wake up in the morning, drink water, at least a bottle of water. Some say a glass, but I say a bottle. And when I say a bottle, like a 50 cl bottle of water. If you could take more, fine. You realize that you empty your bowels, you start the day fresh. Have breakfast. Also, reduce your dietary intake of salt. Reduce salt, even Maggie. I'm not saying completely stay away from it, but reduce it in your meals. Reduce it totally in your meals. And then, for example, these concentrated drinks, carbonated drinks, juice, try your best to make sure that water is the drink you take mostly. If you have to take sugary drinks, you can take them during the day, but little. Don't let them replace water. And then you check your blood pressure. But try your best not to put your mind to it. Also, all these things can be in place and you are not mentally fine. So you need to work on your mental state of health. So whatever is bothering you, set it aside, find solutions to them so that you can sleep and wake up in peace. A lot of people have hypertension, not just because of what they eat or their lifestyle, but because of the thoughts, the worries, the situation of the country, they wanting to make ends meet, the salary not flowing with the savings being spent, salary not enough. A lot of things. Majority of hypertension is caused by thoughts. So if you can work on your thoughts, everything will be fine. And even despite the fact that they say medication is for a lifetime, I know sometimes your BP is normal in the morning, and some use medication and then they dip. They have this dip, this hypotension, which is not good. So you still have to check your blood pressure on a daily basis, but don't check it with the fear of it's high again. You also have to be optimistic that you're fine.
So let's take our last question for the night. It says, what could be the cause when you get your eyes checked and you've been given prescription glasses, but after using the glasses, you still can't see well on screen or concentrate on the particular thing you're reading on screen? And I went to different optical doctors to do an eye examination, and the same thing said again. And I'm left to strain my eyes because I get tired of going back. What could be the
Okay.
cause?
All right. So there are two things. We have the optometrists and we also have ophthalmologists. So it depends on who you went to see. And we have the roadside people that make glasses and call themselves doctors. So it all depends. If you've gone to see an optometrist about twice and they've just given you glasses, you might need to see the ophthalmologist because there might be something else. And you won't be surprised that it might just be a mistake, an error on your refractive index. So you might have to go for a different refraction. So my advice is see an ophthalmologist first. Complain to them. You see an ophthalmologist mostly in teaching hospitals where, not seeing the optometrist to ophthalmologists. And when they check you, or some optometrists that can actually, check you properly and think as outside just prescribing glasses. Let me put it that way. So when they check your eyes, they check the pressure of your eyes, they check the angle of your eyes and inside your eyes and all. Those ones can tell whether you really need the glasses or not. And if you need one, they are careful to prescribe your glasses. So take the lenses along and also lodge your complaints to a different hospital this time around, preferably a teaching hospital. A teaching hospital where you see the specialists, not the optometrists. Optometrists only prescribe glasses. They are not doctors. And it's not wrong to complain, to take the glasses back. They could make a mistake. And the people that cut the lens actually could make a mistake. I hope I answered the question.
Okay, thank you very much, Dr. Feyitola. Thank you very much, everyone, for being a part of
Well,
today's webinar. I believe we've had an insightful and educational session, from understanding the importance of healthy living to exploring how quality food consumption contributes to overall well-being. I hope you found the discussions and questions and everything valuable and very practical. As a tribe, what we've done today is important. We've reinforced that our community is not just about participation, but about shared responsibility for better living. Before we close, I would like to remind everyone about our upcoming tribe assembly scheduled for 1st of May. Please note, attendance is compulsory for all tribe members. However, physical attendance is strictly by invitation. The registration is still ongoing. The invitation letters will be sent out with seat numbers. They've already been sent out to members who have confirmed their physical attendance. And for everyone else, the virtual link access has been shared upon registration. We encourage everyone to be a part of this important gathering, as it will further strengthen our community and align us for what lies ahead. Thank you once again for your time, your engagement, your commitment to the Palmrich Tribe. Have a wonderful evening. We look forward to seeing you at the Tribe Assembly. Thank you, everyone.